Fantastic. Thank you so much for the opportunity to share with you today. I'm Dr. Courtney Cuthbertson, and I'm an assistant professor and extension specialist in human development and family studies at the University of Illinois, and I was formerly at Michigan State University Extension. And what I'll be talking about today in short is about how community members do want to help agricultural producers with the stresses they face. And what I'll share is about the development and effectiveness of a program that has improved skills and confidence for people to be able to help. You can find the full article by scanning the QR code that's on the screen or on the poster. So what we know about mental health in agriculture in general is that when we see things like depression, anxiety, and suicide rates, they're often higher among agricultural populations than they are among the general population in the United States. In 2016, the Michigan Department of Agriculture and Rural Development contacted Michigan State University Extension with a concern over increasing numbers of agricultural producers who were attempting or dying from suicide. And given Extension's strength in providing research-based educational programs, MSU Extension decided to focus efforts on providing mental health literacy programs. Mental health literacy refers to three things: knowledge to identify signs and symptoms of mental health issues, skills and confidence to communicate with someone experiencing distress, and third is skills to connect distressed people to resources that may help or to be able to encourage help seeking. There are some very well-known evidence-based mental health literacy programs, such as Mental Health First Aid, which is an 8-hour program. MSU Extension successfully offered mental health first aid and received feedback that while the course was valuable, people wanted information that was more specific to the context of agriculture, paying attention to the unique stressors that producers face. And they also wanted a training that was available in a shorter time frame. With that in mind, a team of us at Michigan State University Extension created the first program called Communicating with Farmers Under Stress. So the intended audience included people who worked with but may not be producers themselves. The programs were facilitated by teams of 2 extension educators, one who had a background in family consumer sciences or in mental health, and the other educator who had a background or expertise in agriculture. The goals of communicating with farmers under stress were to have participants experience improvements in knowledge about agricultural, economic, and financial trends, because those are so often stressors for people in agriculture, to improve understanding of the impacts of stress on the body, improve recognition of warning signs of things like depression and suicide, and improve knowledge about resources to share with distressed people or where to send them for help. In a 1-year period from October 2016 through October of 2017, MSU Extension offered 25 of these workshops to over 1,000 people. Using a post-training retrospective evaluation at 18 workshops, 342 participants provided their reports of the knowledge and skills that they gained from the training. Within that group, 58.2% were female and 96.3% were white. Largely, what we found is that the majority of participants noted improvement for all 4 goals of the program. The lowest percentage of participants improved in the area of gaining a new understanding of agricultural financial situations, where we still saw improvements for over 3/4 of participants. 23.1% indicated they were already familiar with that information, which is probably due to the nature of their jobs, as many participants worked in farm financial services. 91.5% improved their recognition of warning signs, and 96.5% improved their knowledge of where to send people for help. 88.3% improved their understanding of the impact that stress has on our bodies. And with this in particular, it was significantly different by sex, where 84.8% of female participants reported improvement compared to 93.5% of male participants. And this difference is also explained by that percentage indicating they already knew the information. So a higher percentage of female participants indicated they were already familiar with that information compared to male participants. And other studies of health and mental health literacy have demonstrated similar findings, that female participants have higher health or mental health literacy than male participants do. We did not observe any differences by race, but this is likely because our sample was nearly entirely white. We did conduct a follow-up survey in August of 2018, between 9 and 21 months after program participation. 55 people responded to that survey with findings in the second table on the slide, and we found that attending the program continued to impact people those months after they had attended. 94% indicated they were more comfortable talking with others about chronic stress. All of them indicated being more comfortable in a situation with someone who was experiencing distress. 89.4% recognized where to send people for help, and almost 80% had shared workshop information or resources with someone else. As a result of the success of this program, we created a second program called Weathering the Storm, and this one was intended to be delivered directly to producers and their families. This second program, Weathering the Storm, includes skills to recognize stress in oneself and to learn and practice stress management techniques. These two original programs are being translated into Spanish. And the success of the Communicating with Farmers Under Stress program has led to collaborations with American Farm Bureau Federation, Farm Credit Council, National Farmers Union, and Farm Service Agency to create tailored trainings for their audiences. Additionally, in January 2019, MSU Extension trained almost 100 Extension educators from over 20 states to be able to implement these programs in their own communities. The instructor training now exists online in a self-paced format, and over 3,000 people have participated in these two programs to date. A condensed version of the training is available for free online, and I'll happily share that link in the chat when I'm done with the presentation. Evaluations of the program effectiveness, including multi-state implementation, continue today.
Hi, Dr. Cuthbertson. Sorry to interrupt. Just wanted to let you know that we're pushing on the 6-minute mark.
Thank you so much. I will wrap up here with a few of the lessons that we've learned as part of this process. First, that it's very important to be intentional with language, including names of programs, to be able to invite conversations on difficult topics, as mental health is taboo in so many agricultural communities. And at the same time, it's important to be direct and clear, as this can help to improve confidence and willingness to discuss difficult topics. Another important message or thing that we learned from these trainings is that we often talk about farm stress in the context of higher rates of depression, anxiety, or suicide, but we need to expand this conversation. Everyone has mental health all of the time. In all agricultural communities and all communities around the world. And we can all use supports. What those look like will be different depending on where our mental health is. So we can expand conversations to include seeing mental health as a spectrum from poor to excellent health, and consider what supports help with resilience, thriving, and mental well-being. Thanks again for your time today, and I'm happy to answer questions when we get to that point.
Thank you, Dr. Cuthbertson. This is a wonderful program.